welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy. We are talking about breast reductions for both men and women. We have liposuction and arm lifts also to talk about. We're going to be taking your phone calls live on the air, answering any question you might have for Dr. Mealy. The number 415-561-8753. We're also going to be posting the phone number to the doctor's office later on, so get ready, of course, to take that down. All right, doctor, we've been talking a lot about reducing. What about reducing the waistline? Let's talk liposuction.
Sure. Liposuction, it's a great tool. We use it for the gynecomastia. Can use it anywhere on the body where the fat is disproportionate. So most common places are on the trunk, the chest for men, sometimes the upper arm or thighs. Just depends on where that fat is.
And how do you do it?
It's pretty simple. You make an incision. We usually put a wetting solution in first. The wetting solution has both some local anesthesia, which helps for after surgery, as well as a little bit of epinephrine, which helps keep things from bruising and bleeding as much.
That's good.
And by putting that in first, the amount of fluid we put in also provides a little bit of compression inside, which also decreases the amount of bruising that we see. Once that's set up, then we just basically vacuum it out. So we use a small cannula, and this is where it gets tricky. You don't want to use a small cannula so that you can get things out gradually and smoothly and evenly. The problems with liposuction would be not getting enough out and leaving a bump, or taking too much out and causing an indentation. Those are the determines good liposuction from bad liposuction. Yeah,
that leads me to my next question. Who is qualified to perform that liposuction?
Well, you want to see someone who has experience. So obviously someone who's doing liposuction, who's well trained. You want to look for a board certified plastic surgeon. One who is an ASPS member will guarantee you that they're board certified, that they're operating in the correct facilities, because we're only allowed to operate in accredited surgical facilities, and someone with some experience. So it helps if they've got some before and after pictures you can look at, or if they'll let you talk to some of their patients so you can find out what their experience was like.
Speaking of before and after pictures, let's go to one. First picture.
So this is the abdomen. So someone has some fullness in the abdomen.
Nice, yes.
Get a little bit more definition afterwards, can bring the waist in a little bit.
Great.
And makes it nice and smooth. Not that she looked bad before, but I think she looked better after.
I know, and no scarring, right?
Very tiny scars, usually down in the groin and sometimes in the belly button or around the belly button.
But everything can be covered. That's great.
Usually very discreet, hard to see.
So the cannula is pretty small, pretty skinny?
I use 3 to 4 millimeter cannulas, so pretty small. And on the face, sometimes even smaller.
Let's take a look at picture number 2.
Sure, this is liposuction of the thigh, so we've got a little extra fullness on the sides, sort of that saddlebag region, as well as the space between the legs, so we open that up a little bit too. And I don't know if you can tell on the TV screen, but there's a little bit of irregularity of the skin beforehand, a little bit of cellulite. Liposuction doesn't really help cellulite.
Oh, that's so sad.
So I have to explain that almost every day. Usually doesn't make it worse. Sometimes it makes it better, sometimes it makes it worse, but usually just kind of leaves it alone. It's more like the pattern of the quilt rather than the fullness or redundancy of the quilt. So when we're unstuffing it, I always have to point that out and be clear about it.
And
so
what
this
about
is liposuction of the neck and along the jawline.
And that's a man's neck?
It's a man's neck, yeah. I do liposuction on men too.
I love that.
In this case, I might use a 2 millimeter cannula, even smaller
Very
cannula.
small, okay.
And if you're staying below the jawline, it's unusual to cause any trouble. Above the jawline, I don't normally do liposuction because of all the facial nerves and the muscles and such. But beneath the neck, it works very well as long as you've got good skin. If the skin is already hanging, then liposuction is probably not your best choice. Probably more like a neck lift.
You might need a lift.
And the same with the arm. So again, her skin is not really hanging beforehand, but it's full. And what she didn't like is when she moved, that weight kept her arm moving.
Oh yeah, the bat wings.
So in this case, doing liposuction worked well because she's young enough for her skin to recoil, and we're not going to make that bat wing just deflate and get worse.
Skin tightened up, and we don't have to have the scar, which is nice. All right, I've got a phone call for you, Dr. Julia from San Francisco. Julia, hello there.
Hi.
You got a question? Go ahead.
Yes, I've lost a lot of weight. And,
congratulations.
I'm in my early 60s, and I need, I guess, a body lift because of the loose skin.
The skin does tend to stay loose, especially when we're not 20 anymore. When we're 20, we've got a lot more elastin fiber, so it's like deflating a balloon that's overinflated. It'll keep its shape, but as we get older, our skin naturally loosens up anyway. And if it's been stretched out by weight gain previously, it does exacerbate it, makes it worse. So the lower body lifts are sort of the lift that's kind of removing a belt of skin around the middle and pulling up the pants, pulling down the shirt, sort of tightening everything up. So it's kind of like a tummy tuck that's continued all the way around. The most important thing when we're doing those types of procedures is that you're healthy. We don't have other health problems to worry about, because it is a bigger procedure. It does usually require staying overnight in the hospital at least, and obviously you want to be sure that if you have other health problems, because we do as we get older, like diabetes, high blood pressure, those are very well controlled before we even think about doing it.
All right, thank you so much, Julia, for your call. We are going to be back, and we're going to be talking arm lifts when we get back. Again, you can call us 415-561-8753, and if you need more information about Dr. Mealy, call him at 925-943-6353. Check him out on the web at either drmealy.com or sanfranciscobreast.com. We'll be right back on Body Beautiful.